Hello folks, welcome back. This is Kweku. I am a pharmacist. In today's brief video, I'm going to be reviewing the medication Famotidine, or Pepcid as it is known by its brand name. We're going to take a look at what it is, what it is used for. We will take a look at some potential side effects, how to take the medication, and stay tuned to the end as I'll be discussing two rare but relatively serious side effects of Famotidine that you should be aware of. By the way, this and all my other videos are for informational purposes only, so do not use it as a substitute for medical advice from your physician. So what is Famotidine? Well, Famotidine belongs to a class of medications called histamine blockers or H2 receptor blockers. They work primarily by reducing the acid production in the stomach. Famotidine or Pepcid is used to treat ulcers, which are sores in the lining of the stomach or in the intestines. It is also used to treat a condition called gastroesophageal reflux disease, or GERD for short as we call it, which is a situation in which there is a backward flow of acid from the stomach, which obviously is painful and irritating, but it can also damage the esophagus. It is also used in people that are considered hypersecretors of acid. These people produce way too much acid than the body can handle, a condition that is called Zollinger-Ellison syndrome. Famotidine may also be used to treat acid indigestion or sore stomach arising from maybe eating certain kinds of food. Maybe you ate some spicy food or you had too much to eat. Famotidine may be employed in the treatment and prevention of such scenarios. So how should Famotidine be taken? Well, first and foremost, because it is used in a wide variety of conditions, it is best to follow the directions on the package carefully. If you're taking it as a prescription, make sure that you're following exactly what your doctor's intentions are. But on the whole, it may be taken maybe once daily at bedtime, or in some instances twice daily. There are some instances where it can be taken up to 4 times a day or every 6 hours. These are typically situations that involve people who are hypersecretors of acid, and typically if you are taking up to 4 times a day, then you're most likely taking the prescription version and not the over-the-counter version. Now some side effects. Famotidine, I must say, is generally well tolerated. Most people are able to take it without issue. Some common ones that have been reported include headache, occurring in up to about 4.7% of the population taking it. Dizziness in about 1.3% of the population. Constipation occurring in about 1.2% to 1.4% of the people taking Famotidine. And diarrhea occurring in about 1.7% of the people that take Famotidine. Famotidine and pretty much almost all the other acid reducers have also been known to cause a situation where there is a decrease in vitamin B12 levels. So if you are taking Famotidine, especially if you're going to be taking it on the long term, it's definitely a good idea to monitor those B12 levels or to take a supplement vitamin B12 if you think that you are low on vitamin B12. Now the two rare but potentially serious side effects that I talked about in the beginning. The first one is seizures, and this is very rare, occurring in about less than 1% of the people that take Famotidine. So if you have a history of seizures to begin with, it will not be a bad idea to get clearance from your doctor to make sure that you're a good candidate to be taking Famotidine. This is very rare though, less than 1% of the population, but you better be safe than sorry. Famotidine also in very rare instances has been associated with mental status changes. So irritation, hallucinations, insomnia, a whole list of mental status changes that can occur when you take Famotidine. The good thing though is that it is reversible. That means that once you stop taking it, these symptoms go away, but definitely something to be on the lookout for. And if it does happen, it will not be a bad idea to discuss with your doctor. First of all, you discontinue it and then let your doctor know about it for the best way forward. Thank you so much. This has been a high-level overview of Famotidine. I hope you found some value in it. If you did, please give it a thumbs up and don't forget to subscribe to the channel if you have not already done so. Thank you. I'll catch you on the next video.